You just woke up and you looked in the mirror and said, oh my God, what happened to me? I mean, I've got craters on my face I never had before. I got more chins than a Chinese phone book. What do I do now? What do I do? Well, if you looked in the mirror and you don't have self-esteem, because basically that's what we're talking about here. It's image. It's how you see yourself and how you visualize yourself. I mean, people who have positive images in themselves display it every day in what they do. They go out and interact with their friends and their family, and they have a positive attitude towards life. And those people who don't see themselves quite so positively, they're depressed. They sit around the house. They lay on the couch with nothing to do because they don't think there's anything for them to do. And one of the greatest things that I've seen in my practice as a plastic surgeon that help people think about the times when they were happy and think about the times when they really were productive in life is doing facelifts. A facelift is exactly what it does. It gives you a lift, but it gives you a lift not only physically in changing your appearance of your face, but also mentally. And let's talk about some of the things that we do when we do facelifts as plastic surgeons. Now, a plastic surgeon may give you a different name for these facelifts. He may call it an S-lift or a delta lift or a quick lift. There are a ton of names, but basically what he's talking about is elevating the skin off of the muscle and lifting it and tucking it. Now, what you want to do first of all is check the qualifications of your plastic surgeon, your cosmetic surgeon. You want to know what he has done, how many he's done, and what he is trained in doing. Usually, in my practice, a facelift is done with a patient under a sedation anesthesia. We don't usually put these patients to sleep, and we don't do that for a number of reasons. Years ago, when patients would be placed to sleep, they would wake up and buck on the tube. They'd try to get that tube out of their mouth, and they'd raise their blood pressure, and they increase the risk of bleeding underneath the skin, called hematoma. So typically, it's a twilight anesthesia, although this can depend upon your own physicians and how they want to do it. The patient will come in the morning, we'll evaluate them, and we've already talked to them about the pros and cons of this surgery. And we'll give them some sedation to just gently put them to sleep. The incision then is made along the area of the earlobe, on what we call the tragus, and then continuing behind the area of the ear if you're doing a full facelift. Now, it really depends on your face and your facial structure as to what type of facelift you may need. If you're drooping here in what we call the nasolabial folds and get the jowling here, you may just need an upper facelift or a temporal facelift. In that case, that incision starts at the hairline, in front of the ear, down to the area of the lobule. And what you do is just gently lift this, elevating the skin, tightening the muscle, and pulling back gently. And we've done that in the mirror. You've looked in the mirror yourself and said, boy, if I just look like this. And that's basically what you want to do. Now, having trained in Beverly Hills, I've seen some facelifts that are really bad. I mean, patients would come in and they look like they came through a wind tunnel because they're so tight. The art of a facelift is making somebody look natural, making them look younger, reversing the hands of time anywhere from 7 to 10 years. And that's basically about how long this facelift will last. You undermine the skin. We've seen the movie Face Off with John Travolta, where they actually take the face off. We don't actually take your skin off and put it on somebody else. What we do is just undermine your skin, tighten it gently, pull it back slightly so that you look more relaxed, more natural, eliminating the nasolabial folds and taking away the jowling that you have. We do that under a sedation so that the patient, when they wake up, doesn't really know where he's been, doesn't care where he's been, he just knows that he looks better. Now, the stitches that we have here will stay for about a week. In about a week, those can come out. At 2 to 3 days, we have the patient take off the ACE wrap or the surrounding tissue we have around there to hold everything in place, and then have him wash his hair and do whatever they like to do. The main thing you should qualify is when you do this is what your downtime is. If you have considerable amount of downtime, perhaps a facelift is not for you. You'll need something that we'll talk about later in fillers and liquid facelifts. But a facelift is an outpatient procedure. You will come in, you will go home the same day. The skin will look tighter, but not flexed and look like you went through a wind tunnel, and the stitches will come out in about a week. If you have jowling to your neck, if you have the turkey gobbler deformity, then there are other things that we can add to this. We can look and then actually make an incision underneath the chin, liposuction the chin. Liposuction is a little technique that we put a little cannula, a little hollow tube in to be able to suck away the fat, and we've all seen it, we've all read about it, we've all watched it on TV. And what you do is suck away the fat to give a nice clean line and then pull in this direction. So when you combine an upward pull here and a pull behind the ear, you do what we call a full facelift. A temporal lift and a neck lift to be able to clean out the neckline and the area of the upper face. That technique in doing this full facelift Takes a little bit longer. It may take about 3 hours, 2.5 hours for that surgery, depending upon the expertise and the amount of time that the patient has been trained and the physician has been trained in doing this surgery. After surgery, most patients don't even hurt. We give them pain meds, but usually they don't even need those. We give them some antibiotics and something to take away the swelling that the patient might have. The other thing you always want to ask your surgeon about are what are the complications with this? The complications can be and are rare with this, but they can occur. You will have some transient numbness, some temporary numbness along the area of the anterior portion of the ear. That is normal because we lift the nerves off the skin and they have to find themselves and regrow. The downside of this surgery is that you will have to stop taking any anti-inflammatories, any aspirin or Advil or Motrin or Bufferin. So if you have arthritis or those type of things, you may have to take Tylenol for a week or 10 days because those things thin out your blood, make it so thin that you can get bleeding problems after surgery. Infections are rare with this, although we typically give patients antibiotics postoperatively. It is very rare with this surgery. You will have some swelling, however, you will look better immediately, but the swelling may last for a couple of weeks after surgery. The other thing you should inquire about your physician is and tell him about every medication you're on, because some of those can interact with what we're doing, as well as herbs such as ginkgo biloba or ginger or ginseng or omega-3s or fish oil. They all thin out your blood. If you're a smoker, we won't do your surgery unless you stop smoking for at least a month before surgery because we can see complications of skin loss, we can see complications of bad scarring, and we can see wounds that don't heal. So please tell your physician before you do that about all the medications you take and whether you are a smoker or not. A facelift can actually put on a new face, make you feel better about yourself, look in the mirror and say, you know what? For the first time in a long time, I like what I'm seeing.